Good morning, everyone. May I request everyone to settle down. Welcome to our biannual Coloplast Care-OAS event. Healthy body, healthy peristomal skin. My name is Francis. I'm a senior product specialist at Coloplast, and I'll be your MC for today. Today's event is co-organized by Ostomy Association of Singapore and Coloplast. Through this event, our speakers will share their expertise in maintaining a healthy life with the right ostomy appliance change routine and exercises that are suitable for ostomates. For those of you with us here today physically, we will also be having a live stretching, exercise, and hands-on product workshop. It's always good to see familiar faces, and hope you enjoy the rest of our event today. And to kickstart our event, it is now my pleasure to invite Elil to give us a welcome note. He is a co-founder and a current president of the Ostomy Association of Singapore, a co-chair of SingHealth Patient Advocacy Network, and has a leadership roles in the colorectal support groups in the Singapore General Hospital, Changi General Hospital, and the Singapore Cancer Society. He is none other than Mr. Elil, who is living with a stoma, and he will share more about the challenges of living with a stoma in Singapore. Yeah, so while waiting for Mr. Elil, oh, he's here now. Okay. Mr. Elil, please.
Thanks. Right, thanks, Francis, for holding the fort while I was gone. Apologies for being a bit late. I had to go powder my nose. So good morning, everyone, and thanks so much for spending this Saturday morning here with us. It is so nice to have an in-person event again. I've really missed this a lot, and happy to meet everyone face to face. This is the first of the Coloplast Care events for this year, and this is in collaboration with the OAS. We have our patient and healthcare professional education series, and under this series, we work with our industry partners to bring events like this to all our members. I'm a bit out of breath because I ran from the toilet. So I think the value of such an event is that when industry partners and agencies like the Ostomy Association of Singapore can come together and provide events like this where we can disseminate information to ostomates in our community, all right? Be it new products and other information, treatment options, stoma management options and stuff like that, right? So this partnership is very important because working individually, we can only do so much, but working together, we can pool our resources and reach out to more people, right? We are still trying to find out the exact number of ostomates that in Singapore, and we are working with consultants to find out. One of the reasons why we want to know is that so we can use this figure to maybe lobby the healthcare authorities and even Ministry of Health to see how they can help improve the quality of lives of all ostomates in Singapore, like giving them access to handicapped toilets. Or even in the near future, the dream is to have special ostomate toilets available. But these are things that are not done easily, but I think we are taking baby steps, and with the support of our industry partners, I think there's a lot we can achieve, right? So that's a bit about OAS. In fact, right now, we are doing a survey, which is done by our consultants, actually. We engage them to do a survey so that they can tell us what are the actual needs of the ostomates, right? So the survey is up on our website and on our social media platforms. So please go in and do that survey, all right, and tell us what is important to you, right? Sometimes we think that this is what you need, but what you need could be something completely different. So these are the channels where you let us know. And what we want to do is we want to focus on the things that we should be doing which will actually help the ostomate. Not just do a lot of things, but in the event it proves not to be so useful, right? So please help us do that survey. Help us understand what your needs are. Help us to serve you better, right? The survey is up on the website. If you want the link, you can look for me later. I can send you the link via WhatsApp as well, right? So I won't take up too much more of your time, but it remains for me to thank you for being here. And the assurance I want to give you is that our industry partners like Coloplast and the OAS are here to provide the help that you need, right? Whatever form. If we cannot do it ourselves, we will make sure that we hook you up with someone who can. So please reach out and tell all your fellow estimates and friends that help is available. Reach out, and together we can improve the quality of life of the ostomate community in Singapore, right? Thank you very much, and back to you, Francis.
Thank you, Elil. Indeed, in behalf of Coloplast, we are grateful that we are able to collaborate with you guys, and we hope that we can continue to do this, especially now that we are easing COVID restrictions. Hopefully, we can do more events to spread more awareness. We are having hundreds of new ostomates every year, so hopefully we can reach out to more patients to share knowledge and the expertise of our ostomates and our clinicians here. Moving on, our first speaker is Miss Angela Liu. Sister Angela is a nurse clinician, and she attained her graduate diploma in wound ostomy and continence nursing from Curtin University in 2018. She has a diverse interest in wound care, particularly in the management of skin tear, pressure injury, vascular ulcers, and ostomy care. Angela will be sharing on ARC, meaning apply, remove, check, an ostomy appliance change routine that aims to simplify the lives of ostomates. Miss Angela, please.
Hi, good morning, everybody. My name is Angela. I'm a wound and stoma specialist. It is very good to finally see all of you face to face after 2 years. And I hope in time to come, we'll be able to meet more ostomates face to face as well. And for those of you that are joining us from the comfort of your home, good morning to you too. All right, I hope to see you sometime soon. All right, so today I will be sharing with you on the ARC, which is the apply, remove, check method, and how it simplifies your life as ostomates. Now, before I begin, I would like to thank Coloplast and the Ostomy Association of Singapore for the development of today's session, as well as the many education and collaboration sessions that you have to reach out to ostomates and their caregivers as well. So don't forget the caregivers, because they also take up a very heavy burden these days, right? So I think we only have a short 30 to 40 minutes, so let's get started, all right? Okay. So for this morning, I'll be running through some definitions and terminology that I'll use during the talk. I will touch briefly on the indications of a stoma and ostomy creation, and just how big this scope of the problem is in Singapore. I will share on a journey that a lot of ostomates and their family members go through at the start, and why it's important to have a simple pouching system method to reduce the mental burden for all of you. I will share on some case studies of the frequent issues some ostomates may face that you may not be aware of, and we will end with a simple demonstration using the ARC method over there. For those that are here, you actually do have some requisites on your tables, so I think you can feel free to try it as well, and I think our Coloplast experts will also be on board to help you as well. All right, so some of the terms that I will use firstly. Right, so the first term is actually ostomy or stoma. A stoma is actually opening that is created during surgery from an area inside the body to the outside. So the examples of a stoma can be an ileostomy, which is the small bowel, a colostomy, which is your large bowel, a ileoconduit, which is a urinary stoma, or a tracheostomy. All these are examples of a stoma. An ostomate is defined as an individual who has undergone a surgical procedure to create an ostomy or a stoma. And the peristomal skin, all right, is defined as the skin that's surrounding any ostomy in direct contact with the skin barrier of the pouching system. Okay, so these are some of the terms that I'm using. So everybody will be asking, first of all, why do patients need to create a stoma? Why do we need to do this difficult thing, this challenging thing? Why is it that the doctor cannot open up and then just close it on the spot? You know, I don't have to live with a stoma anymore, right? So a lot of times, the first indication and the most common indication is malignancy. All right, so this one I'll elaborate a little bit more about the statistics later on. But the reason why malignancy is one of the reasons we create a stoma is because dependent on where your tumor is, sometimes if it involves your anus and your sphincter muscle node is also removed, then you will have permanent incontinence. When that happens, of course, having a stoma is less challenging to manage in comparison to having to manage incontinence for the rest of your life, right? So the other thing would be also, we do have patients who come in very deconditioned, extremely ill, and they need to go for emergency surgery. That can be in the cases of abdominal trauma, volvulus, which is the twisting of the intestines, intersusception. Intersusception is when the bowels go into each other, all right, and obstruction as well. Obstruction can be from anything, it can be from a tumor as well. So those are the instances that we need to create a stoma for our patients, all right? And of course, other causes can be inflammatory bowel diseases. So we do have people with this condition, and they may need to remove a segment of their intestines, or perhaps the entire large bowel, and this will require them to have a permanent or temporary stoma. So these are some of the indications for fecal stoma. However, we do have patients who have a urinary stoma. So a lot of misconception is that the stoma is only to drain feces, but that is not true. We do have patients who have what we call an ileoconduit. Now, the main indication for urinary stoma is also malignancy. So what they do is that they actually remove the bladder, so you no longer have a bladder. But what they do is, in the same setting as the ileostomy, they take the end of your small intestines, they create a conduit. So what it does is that they connect it to the ureters that is connected to your kidneys, and what it does is that it will connect to the outside of your body in a stoma. So it drains out the urine as well. Okay. Now, we do have some patients who are actually have stomas created because they are in the palliative setting. Now, we do have patients who come in severely obstructed, and they find that these patients already have metastasis. So they are having very severe symptoms, vomiting, bloatedness, they can't keep food down, and you know that they still need that quality of life. So for this patient, sometimes surgeons, they do create stoma for them, is to relieve the symptoms so that they can actually have some pleasure feeding at the end of their life, all right? So these are some of the indications for a stoma creation. Now, how big is the scope of problem in Singapore? So I actually went to find the statistics of ostomates in Singapore. I can't really find it yet. Maybe that's why your survey is very important. But the thing is that in Singapore, colorectal cancer remains the #1 cancer in Singapore and the #1 cause of death in males. For females, it's the second highest after breast cancer. Now, 1 in 20 patients actually do refuse surgery due to their anxiety and the misconception that they have in managing a stoma. That having internet readily available is like a double-edged sword, because when you get information from credible sources, then you can make a good informed decision. However, when you start reading on personal opinions, alternative treatments, that may not be the mainstay. That is when a lot of people get a lot of confusion. And that's why it's always important to have a good support group in hospitals, acute hospitals, so that you get good vetted information to make a more informed decision about your treatment, okay? Now, 1/4 of patients who are operated on, they have to have a stoma, be it a defunctioning one, where after you finish your treatment, you can close your stoma, or a permanent one, depending on where your tumor is as well, okay? Now, I'm not an ostomate, okay? And everybody's journey is different, okay? Nobody can say that your journey is the same as mine because everybody goes through and thinks about different things. Now, for ostomates, what is the first thing that is difficult to accept? Sometimes at the very start is the acceptance of your diagnosis. Be it whatever diagnosis it is, it's going to take some time because be it in an emergency or a planned setting, nobody wants to go for surgery, right? So the thing is that if patients cannot accept their diagnosis, it's very difficult for them to move on, to talk about treatment, to talk about plan of care, to talk about what is our next step. Because the very first thing that they need to do, which is to accept their diagnosis, they cannot even do it. All right? So acceptance of diagnosis, the first one. Next will be surgical risk. Now, for anybody that goes for surgery, there are two kinds of risks that you're subjected to. Number one is anesthetic risk. Number two is surgical risk. So for someone who's younger, not so many comorbidities, of course you are at lesser risk. But that being said, doesn't mean that you have multiple medical problems. It means that you are at high risk for complication or high risk for your surgery. If you can manage your comorbidities well, that is not an issue for you. The anesthetist will be taking care of you as well, right? So the third one will be the change in body image. Now, there are a few studies that show that having a stoma actually alters your personal perception of your body image very much, and even more so in younger population, right? However, but that being said, if you are increasingly more familiar with being able to manage your pouching, and you do not spend a large portion of your everyday life worried about the stoma, thinking about the stoma, thinking about the perception of other people with you having a stoma, then you will find that as a patient, as an ostomate, you'll be able to accept having a stoma that much easier, okay? So having the acceptance of body image change is very, very strongly correlated to the ability to manage your stoma, okay? Now, financial considerations, number one thing on everybody's mind, okay? If anybody that goes for surgery, there will definitely be some downtime, all right? Be it a few weeks, be it months, because you need to go for subsequent oncologic treatment. So time away from work can be challenging, especially for patients who are the sole breadwinners of the family. We do still have patients who are the sole breadwinners. And not only that, if your parents are no longer working and you are the main caregiver taking care of your parent, a lot of time the burden falls on you, because not only do you have to financially support the family, you have to emotionally support the ostomate, and also you may have to help them with the pouch changes, with the everyday life, to support them in all these aspects can also cause caregiver stress for the family. And in return, there can be some impact on your relationship dynamics, and for those patients who are actually very independent from the start, it is very, very difficult to take on the sick role. Because when you have to take on this sick role and you have to ask someone for help when you've been independent all your life, it is actually very, very difficult for them to do so. All right, so we do have patients that say, no, I don't want anybody to touch me. I want to do it myself, right? We do have patients that do that. And yes, we can. We should empower our patients to not leave everything to the caregivers so that there's less burden on them as well, okay? Now, of course, we talk about oncologic treatment and palliation. So this comes after the surgery. So it's a journey that ostomates have to take, all right? And for those patients who have to go through this, it is not easy because you're traveling to the hospital all the time, all right? You have to do the side effects of the medication that you're on can also cause you to be very exhausted, nausea, vomiting, a lot of high output, and generally you just feel like you're not yourself. Okay, and lastly, the ability to cope with a stoma will also determine how quickly you can return to normalcy, right? And that being said, this is only the journey of ostomate before you even go for surgery. So what happens after surgery? You will have to deal with post-operative pain, all right? But these days, we are all doing, the surgeons are all doing keyholes, so I think the amount of pain that you have is definitely much lesser. All right, you may have to do post-operative wound care, and if touch wood you get a wound infection, you have to come back to the hospital for regular follow-up and dressings. Some of you patients who have already deconditioned a lot before surgery, you may have to do some intensive rehabilitation because we don't want you to deteriorate after surgery. That may be one of the things that you need to look at. Now, the other thing is that there's so much information overload for ostomate, because when I come in and I tell you, hey, look, I have all these pouches for you to choose. I need to tell you how much is the pouch, what type of pouching system, what's the wear time of the pouch, and what are your dietary restrictions, what you should be packing in your kit and things like that. It's really an information overload for the ostomate, right? And for the caregivers as well. So the first thing that they'll tell me is, you just give me the best one, okay? But the thing is that every single system does work, all right? Be it a one-piece or a two-piece. It's dependent on your convenience, your preference, your wear time, how often you want to change the pouch, right? But that's not a decision that sometimes you all can make on the spot, because you think you need to try it first before you can make a good, solid decision, all right? Because products cost money, and we don't want you to waste your money as well, okay? So of course, at the back of your mind, you'll be concerned about your family. Is my child doing their homework? Am I going to lose my job? Things like that. And I do have patients who, after surgery, they've got multiple tubes and they're working on their laptop, all right? Because they are concerned about their work and their job safety as well, okay? So these are the things that ostomate will have to go through. So couple this with the slide before that. Just how many things do you need to think of, you need to go through, right? Before you even go down the next stage of treatment. So that's the reason why I think that there must be a simpler way to change the pouches. If you look at the number of things you have to deal with, the mental burden is really high, okay? So if you can do a proper pouch change that does not take up too much time in a week, be it a once a week change or twice a week change, then it will actually reduce your mental burden. Now, having something that like leakage or peristomal erosions is actually a cascading series of events. Let's say if you are someone who has frequent leakages from your ostomy appliance, right? What is going to happen? The first thing that happens is that you get very anxious, right? You get very anxious, oh goodness, my pouch is leaking. So when you're very anxious and worried about leakage, what you're going to do, you're probably going to stay at home. All right? If you stay at home, you don't want to go out, your friends text you, hey, you want to go out for tea, things like that. No, you don't want to go out because you're worried about what will happen if it leaks, what will happen if you have an accident in front of your friends, right? So this leads to a lot of social isolation. When there's social isolation, what happens then? You have more time then to think about your stoma. And then all these negative thoughts and train of events just culminates into a person who is always at home, doesn't want to go out, and thinking about their stoma all the time. So we should not go down this cascading series of events, okay? Now, it will be easier for caregivers to manage as well. So if you pouch it well, you do it once, you do it well, caregivers only need to spend 20 to 40 minutes in a week having to change the pouch. The rest of the time is managed by the ostomate in the drainage, right? And if it saves your time, it saves your cost as well. So if you do not use a proper pouching technique to pouch the bag, what it does is that you may end up having to change 5 pouches a day, okay? So if you talk about a one piece, which is about $4 or $5, you can end up spending $20, $30 a day or even a weekend till you get to see a stoma specialist. So we don't want that for you, right? And lastly, that when there's less emphasis on the stoma, you can pay more attention to your everyday life. You can still continue to go out on walks. You can still continue to have gathering with your friends, go out for meals and all that. Your life should still go back to this new normal, all right? The only difference is when you go to the toilet, you just drain it out rather than going through the other way, right? Okay. So, which brings me to this. Why I think that this ARC method is fantastic is because they simplify it for you such that it's easy for everyone to understand. So when we do pouch teaching for patients in the hospital, we always have asked them to record and all that. But sometimes recordings can get lost. People can delete videos and things like that. So when you have something that is easy for you to refer to, then it will be easier for you to do your pouch changes at home. So the first one we talk about is applying it correctly with that the skin is well protected. Next would be using the correct removal technique as well, because improper removal can also cause skin issues. And lastly, the check. They'll be checking on two things, checking on the peristomal skin and checking on your base plate. So the regular practice a lot of patients have is that once they remove the base plate, they just throw it away. But it's always very important to take a look at the back of your base plate, because a lot of times if you have leakage and you have some skin irritation, it is likely you will be able to see that pattern on the back of your base plate as well, okay? Now, the first one would be to apply. So be it you have somebody helping you, so you lie on the bed or you stand up, your family member helps you to take out the pouch, all right, or to apply the pouch. You wash, either you clean it with paper towels or you go to the toilet, take out the entire bag and do a good wash with soap and water. Anyway, it's up to you. But when you want to start pouching, you always ensure that your skin is clean and dry. We do not advocate for any moisturizers. We do not ask you to put any alcohol cleansing solution, because this is not a wound, this is a stoma. So when you put any alcohol on your skin and you leave it there, what it does is that it dries the skin and it causes a lot of irritation for the patient. So just normal soap and water is fine. You don't need to even use saline. Let's put it this way. When we go to the toilet normally, we don't use saline to clean our backside, right? So it's in the same way, we will not use saline to clean our stomas, okay? Unless you have a wound over there, then that's a different story. You should keep a template of your stoma shape to use for comparison, and you should create a new one if you find excess of peristomal skin when you align the template for cutting. So later I'll be doing a demonstration. I think it will be easier for you to appreciate what I'm talking about. So the size that you cut should always fit the stoma just nice. It should not be too small, such that it cuts the stoma. It should not be too big, such that you have peristomal skin that's exposed, all right? Now, the appliances, if you have leakage issues and you may need additional appliances like paste, like strip paste, like stoma belts, okay? So that will be subjected to either the recommendation of your vendors, your Coloplast vendors, or even the stoma specialists, okay? And you must always be in two positions only, either you're standing or you're lying down. You should not be sitting to change your pouch, because when you sit, you have a lot of skin folds, all right, and that will cause leakage for you. Now, in time to come, when in the initial phase, your stoma is very swollen, okay? But in time to come, as you eat well, the swelling goes down, all right? Once your stoma size is stable, then you can pre-cut some of your base plates. Now, Coloplast does do pre-cutting, but that should only be done only when your stoma size is stable. You should not be using a pre-cut. You should not pre-cut all your pouches once you receive it to make it easy for yourself at the initial stages when you just go back and when your stoma is still swollen, okay? Now, you should not change your pouches if your stoma is very active. So the time to change, usually the best time is in the morning before you eat or drink anything. Your stoma is not too active. That's the best time to change. But I know caregivers, some of you have to rush to work in the morning. So the alternative would be later at night, maybe a few hours after dinner. You know the effluent is not so much. Sure, you can go ahead and do the pouch change then before your loved one goes to bed, okay? If you're in a rush for time, I would say don't do it, okay? Because when you're in a rush for time, you just want to get it over and done with. That's when mistakes can occur, especially if it's not something that you're familiar with. Then I would suggest to do it at a time where you're more relaxed, you're not in a rush. And all of you who have your pouches changed, you should be either in the lying down or standing position, at least for 15 to 20 minutes, so that your base plate can adhere to your skin properly. It will warm up and it will adhere properly, okay? Now, for remove, okay. For the removal, I would suggest to go low and go slow. That's my recommendation for all kinds of removal of any adhesives. And that's the same for your base plates. All right, so always prepare your requisites before you start, so you're not panicking and having to run here and there to get your things. This minimizes the amount of anxiety you have after you take the pouch. Oh, I gotta quickly pouch it on. So which is why all patients that are discharged from hospitals, you're given a discharge bag given a discharge kit, right? So you are supposed to place all your ostomy products inside this kit. Bring it with you wherever you go. So even if it leaks on the outside, when you're going out, then you can quickly go and change it, maybe in a handicapped toilet as well, okay? So when we remove, it's always a top-down approach. So we remove from the top, we apply from bottom up. Okay, so this is to prevent leakage and your effluents coming out. And also consider the usage of adhesive remover at the side. So I think you can see on your tables, you do have adhesive removers. You can spray the adhesive removers at the edges of your pouch. And then you can slowly remove the base plate. It's actually much, much easier. So always support the opposing skin when you take out. So later maybe I will demonstrate it to you as well. All right. This is actually to minimize the stress on the skin. So every time you take out something forcefully, you actually strip the epidermis of your skin, and we don't want you to do that. We don't want you to have skin tears. But regardless of, the one thing I want you to know that regardless of your routine, be it a 4-day, 5-day, 7-day change, if you find that there's pain, there's itchiness at the base plate, you don't wait till the 7 days, all right? Because there is a sign that there's probably some leakage in there, okay? And you need to get this pouch changed. And if you're changing it very frequently, you may need to get this reassessment done by a stoma specialist, okay? So this brings me to the last thing. When you remove it, you have to check, right? So check the skin, so you can stand and look at the mirror, or you can get your loved one to check it for you, all right? So whatever your skin color is, the skin around the stoma should look the same as the rest of the skin at the abdomen, all right? The other thing would be to check your base plate if it's eroded. Are there feces? Is there a lot of urine that cause the base plate to be very, very eroded? And also examine the skin around the stoma to see if there's any redness or damage. And usually the pattern of erosion you have on your stoma will correlate with the leakage that you have on your base plate, okay? Now, you can consider, so a lot of times patients, after you notice it, right, so a lot of times when you call the vendor or you call the specialist, I need to tell you something, I have some redness, but you can't tell them exactly where is it, but you have some redness and some pain. So I would suggest that you actually do take a photo of perhaps your base plate as well as your peristomal skin after you clean up the urine and the feces and all that, so that they can assess it. I think a picture tells 1,000 words, so that they can actually advise you what needs to be done, okay? Now, I do not advocate for excessive washing of base plates. I do have ostomates who wash their base plates about 4 or 5 times a day. That should not be the case. If it's a one-piece bag, you should only be washing it about once a day. The rest of the time, you just drain the feces, clean up the edge of the bag with some wet tissue, and then you just close it. All right, if it's a 2-piece bag, of course, you can detach the bag. You can wash the bag how many times you want, but the base plate, you do not wash with water. You just use wet tissue to clean it up, okay? Now, just quickly, some case studies. I think I'm running a bit short of time. Okay, so the first one is Mr. A. So he's a 75-year-old. He had a colostomy, which is a stoma at the large intestines, created about 10 years ago. So he has reduced water intake due to benign prostate hypertrophy. So if you do not know what is benign prostate hypertrophy, usually when men, as you age, you may develop this where your prostate enlarges. So the prostate is very near to the bladder. What it does is that it presses on and takes up space into the bladder. So the bladder's space to expand is smaller. So patients have to keep going to the toilet very frequently. So in doing so, patients try not to drink so much water. That's number one, to reduce the amount of time that they have to go to the toilet. Okay, that's actually not too good, because what it does is that he starts having leakage and the stool is constantly stuck on the base plate. I do not know if some of you have this issue as well. So he's very frustrated because every single time he has a bowel movement, he has to change his base plate. Okay, so in this instance, the leakage is actually due to the stool consistency. So everybody thinks that leakage is due to the output being too watery. But when your output is very, very sticky, it can also cause leakage as well. What happens is that in the example of this base plate, is that everything is stuck on the base plate. It cannot flow down. Okay, so when it cannot flow down, what happens is that it can seep to the back of the base plate and cause leakage. So that is also another problem. So what you should be doing is to get your BPH checked out, all right? You should continue to drink water, maybe lessen the amount of fiber they take in their diet. And lastly, also, you can consider applying some olive oil into the bag, all right, to facilitate the feces to slide down, okay? So that's one method you can treat this. Now, the second one is Madam B, 65-year-old lady, just had surgery done 1 week ago, was seen by the stoma specialist nurse, and the pouch was applied and discharged. But she started having this itching, burning sensation under the base plate. So can you see that this pattern here, okay, this pattern here, all right, is actually due to the appliance allergy. Can you see that the pattern is a very well-defined pattern, all right? And if it's due to a leakage, it should be around the stoma, but it's not, all right? It's actually on the outside. So this is likely due to allergy, all right? They definitely need to change the ostomy product that they use, okay? And they may need some topical medication to bring down the inflammation. All right, and lastly, this is Mr. C, 45-year-old, just completed surgery, discharged home. So he woke up with leakage from the ostomy bag. So in a hurry to change the pouch, so he quickly just removed the pouch, and can you see that over here at 6 o'clock aspect, there is some skin tears, all right? This is what we call a medical adhesive related skin tear. Sorry. All right, so again, you refer to the ARC method of removal. And what we can consider using is the crusting method. So this crusting method is something that some of us clinicians use. If you have broken skin around your peristomal area, what you can do is, you know, your ostomy powder, you can put a little bit powder. You must always make sure that you dust it. Then you apply the skin protectant spray on. You can do this for about 3 times. Okay, then you end with the skin protectant spray, and then you pouch on your bag. All right, so this can actually minimize the amount of fluid that's coming out from the skin tear, so that your bag can still last. Okay? Okay, I think it's time for a demonstration. Can you hear me from here? Yes. Okay, let's just say you have a stoma over here, right? Can you see? So if you have your pouch and it's due for change today, all right? So you can use the adhesive remover first, all right? Can you hear me? Okay. All right. Always you can, of course, you should be in a relaxed state. You should not be in a hurry. All right. So what you can do is with the adhesive remover, you spray on the edges of the bag. You spray the adhesive remover at the edges of the bag. All right. So you spray it, and again, after you have sprayed it already, the trick is always to go low and go slow. So you support your skin as you take out the pouch, right? So you support, you take out the pouch. This is when your check occurs. So you check the back of your base plate, you check your peristomal skin, right? You can go and do your shower, you can go and do your cleaning and all that. So when you're done, some of you, if your stoma shape is quite standard, they actually do have a stoma guide, but if your stoma shape is rather irregular, you can consider using a transparent template such as this. So I will show you using the transparent template, okay? So you draw just according to the size of the stoma, okay? So you put a top and a bottom, so you know which one is the top, okay? Now, what you do is that stoma scissors curve inwards, okay? Cut your template out first. Don't think you can see this, but okay. Cut your template out first. Now, once your template is ready, okay, prepare your bag. You can close the ends of your bag first. Okay, so again, the top is your head, all right, and your bag should be facing the direction that you usually do your drainage from. So if someone is bed bound, you usually tilt it a little bit to the side so that it's easy for you to drain out. If the person is ambulant and walking, you face it downwards, all right? So template, top of the head, your base plate, all right? Then you can draw. Once you've drawn it, you have the template already, okay? Then you can cut. So same thing, you always pull out so that you do not cut the base plate. You can cut this way. All right. Okay. The edges, you can do small slit cuts like that. Okay. Now you're ready to apply, right? So if you have any skin issues and all that, if you have topical creams you need to apply on your skin, you should do so now. Apply it and make sure that you massage it into your skin such that everything is well absorbed. Then you can apply a layer of your skin protectant spray. Okay, spray it on all the surrounding. Let it dry first. Okay. Now, when it's ready, you can air it dry. Then you can prepare to pouch your base plate. Okay. So when you pouch it, also it's bottom up. Okay. So after you pouched it already, make sure that you mold the rest of your base plate such that it adheres to the skin. Okay? Yeah. And that's it. Your pouching is done. Thank you. All right. So in conclusion, are we back to the slide? Okay. So I think that having a stoma is challenging, all right? And all of you who are ostomates, you should congratulate yourself on the journey that you have taken to get to where you are today, all right? It's not easy, all right? Especially not only for the ostomates themselves, but for the caregivers as well, all right? A lot of caregivers are the ones who are silently also suffering, okay? So you have to applaud yourself as well, that you have joined your loved one on this journey. You should always tap on caregiver support groups because sometimes you feel that you're alone in your journey. You do not know that there are many others like you. All right, tap on to the support groups, and there is no one method of coping that works. There are many, many methods of coping, be it going out with friends, having a sense of normalcy in your life, you know, or staying at home, watching TV with your loved ones, spending time with them. There are many methods of coping. All right, find your own method of coping, and always don't be afraid to ask for help. Okay? With that, thank you very much.
Yep. Thank you, Sister Angela, for that wonderful sharing. So I think she summarized it very well from the basic anatomy, from the beginning of the struggle of diagnosing with a stoma, what ostomates experience after surgery, and how to manage the appliance, and also using ARC. So in the next short video, let's look at how having a good ostomy appliance change routine, ARC, can help with maintaining a healthy peristomal skin. Let's watch this video.
Prevent leakage and skin complications by establishing appropriate change routines. Apply, remove, check can help do just that. First up, apply. Proper application can ensure the skin is protected from stoma output and the skin complication it may cause. Always make sure the base plate is applied to clean and completely dry skin. Cut the hole to fit the size and shape of the stoma. The key is to make sure the base plate has a snug fit, not too loose and not too tight. If it is challenging to get a snug fit, it may be beneficial to use a supporting product, such as a seal. Remember, the stoma can change size and shape over time, so it's important to check it regularly. If the skin is moist or needs extra preparation, supporting products such as powder or protective spray may also help. Next up, remove. A gentle removal technique will help to protect the skin around the stoma. Pull down the removal tab to loosen the adhesive from the skin. Gently remove the adhesive by rolling it step by step downwards, while applying light pressure on the abdomen with the other hand. An adhesive remover can provide a little extra help. Finally, check. Checking the skin and the adhesive can reveal if the change routine is appropriate. Check if the adhesive is eroded or if there's any stoma output on it. Then, check the skin around the stoma for signs of redness or damage. Using a mirror can be helpful. Healthy skin around the stoma should look the same as the rest of the abdomen. If there is a feeling of discomfort, itching or burning under the base plate, it is important to change it, no matter what the routine is. If there are signs such as erosion of the adhesive plate, leakage on the base plate or the skin, irritated or discolored skin, it may indicate that the product should be changed more often. Life is more comfortable with the right change routine.
Jeg lader ikke min stomi stå i vejen for det liv, jeg lever. Det bliver en anderledes hverdag, umiddelbart lige i starten. Man er usikker på, hvad man skal gøre, og i starten sker der også lidt pålæg, og det ødelægger simpelthen. Det er vigtigt for mig at følge en rutine, så at jeg er tryg i min hverdag. Hvis jeg sveder, kan jeg godt finde på at skifte pladen lidt oftere. Jeg skifter hver anden eller tredje dag. Det er en del af min daglige rutine at skifte pose. Jeg skifter min pose 2 gange om dagen, 1 gang om morgenen, efter jeg har været i bad, og 1 gang om aftenen, inden jeg går i seng. Jeg har spillet badminton i hele mit liv, og det kan jeg jo stadigvæk gøre. Man skal i hvert fald ikke lade sig begrænse af at få en stomi. Jeg lever fuldstændig normalt liv.
Great. So everyone, please do always remember ARC, and for our dear ostomates and for those who are watching online as well, please do remember ARC and hope you get a proper and appropriate routine using this method. Yeah. Other than having healthy peristomal skin, it is also important that we keep healthy. Our next speaker, Mrs. Aziza, will be sharing more about her struggles and how she gets back to an active lifestyle after having an ostomy surgery. Aziza has been an ostomate since November 2020 and has 2 beautiful children. She went through cancer twice, in July 2015 and October 2020, before stoma was created in November 2020. Ladies and gentlemen, please welcome Mrs. Aziza.
Hi, good morning, everybody. I'm Aziza. I'm so sorry, I'm very nervous right now. This is the first time talking in public, so pardon me if I stumble on my words or suddenly I faint. Okay. Not this one. Okay, so far what I've learned in my ostomate journey is that we need to learn to be kind to ourselves. It's okay to be sad. It's okay to struggle because definitely there are bad days and there are good days. We should not be dwelling on the past for too long, because sometimes if you, sorry, suddenly I feel so breathless. I'm so nervous right now. Like, you should not dwelling on the past for too long, because depression, it can lead to depression. So it's important to speak to your loved ones, your friends, touch on maybe your social worker, maybe OAS. They have a very good support group. And after I was diagnosed the first time in 2015, where after I actually cleared my cancer treatment, I actually have this bucket list, is that I want to achieve something to be better for myself, to be more healthy so I can keep up with my kids. So what I actually did, I actually built up a bucket list, the things that I want to do. I want to go for more hiking. I want to join Spartan race, obstacle course race. I want to join Army half marathon. I want to join Standard Chartered half marathon. So this is what I did. My husband has been my rock all this while, so that's him. That's me. That is during our Spartan race obstacle course. That time we were doing our, let me see here, 21 kilometer with obstacle course in between of the race itself. This is me during my 21 kilometer race, then the Spartan race, and also hiking. Hiking depends on your own, say which part you are comfortable. It can be, the easiest one, you can go to Chestnut Nature Park, it can be Hot Park, it can be Macritchie, so it depends what is your suitability. Then along the way, after I've gone through that, this is where actually I was diagnosed for the second time. It was really hard, for sure, as in going through having a stoma, going for surgery, having, how to say, body changes, and also having less interaction with friends, family. I'm always, the first few months, I actually didn't go out because I was so, I'll say, cautious, self-conscious of my own body type. So I always keep inside, say I will stay indoors, stay in my room. So what I would usually do, I would just, for a few times I just cried. When after a long time, my husband spoke to me, my kids, they actually gave me, say, advice, or they actually push, some of them even push me, but especially my husband, is that I still love you as the way you are. So you cannot keep doing this. You have to look forward to something. Give yourself, you have gone through this struggle, give yourself a pat on the back. You are stronger than you are. At first, it definitely a struggle, but along the way, you will be stronger. Along the way, you are strong. Okay, this is me after 5 months surgery. At first, I actually kind of scared to start to be more active, because I'm just have this fear of to injure myself further. But slowly I go first, I actually start with walks just around the nature park, go for a light cycle, go hiking. Hiking is also just very short hikes. Then go for okay. Then from there, after hiking, then I found something I like. I suddenly, for some reason, I like skipping. I don't know why. Maybe because it's a circular area. I just did it in front of my house. Then sometimes I just do it under the multi-purpose hall. So what I did is skipping, and also sometimes I do yoga mat. I mean, as in yoga at the mat work, or maybe like stretching on the mat. Then I recently started rollerblading, because I have 2 kids. They are 14 and 9. So I need the energy to keep up with them. Cannot be like they are running, hey, you wait, I have to catch up with you first. So it's something that I'm trying my best to, at the same time, try to lose my weight slowly. Can see lah. So this is something that I'm trying to be more consistent about it lah. This is what I'm mentioning about. If you don't fancy hiking or going for walks, you can just do a mat work, just a short stretching, do your stretching on your leg, your arms. Sometimes you can just stretch your back, or you just go for short walks. Doesn't matter if you don't want to go for a park. You can just go window shopping at the shopping center. Do you know that I actually can clock my 10 kilometer just going window shopping? So just go window shopping, it's okay. Just grab anyone from your friend, your children, your friends, or whoever going, or if you have time to squeeze for 1 hour lunch, just go to the nearby shopping center lah. I mean, if you shop, then that's not my problem really. But if you want to shop, just make yourself happy, That's what I did. So every time my husband say, hey, why you buy a lot of things? But it makes me happy, what? Okay lah. So no choice, Hey, why this slide show very slow like me? Oh yeah, I'm such a noob with this. So sorry. Okay, this is the appliance that I actually use every day. Since I have actually hernia, so I've always been using the belt every single day, 24/7. It's quite annoying from a start. Well, as the days goes by, actually got better. So it's the same like how you wear your underwear every day, right? So it's the same like wearing a belt lah. Also, I always have this tendency to use high-waisted pants. So it actually helped to give me support. So yeah, for everyday wear, and sometimes even when I do workout also, it's the same thing as well. I use high-waisted leggings. So it actually gives you more support. But try not to use the one that is very tight. So, I mean, it will at least have let your stoma to poop better, I guess. If it's too tight, then the tendency of leakage will be very high. You do not want to have any accident while doing workout lah. Okay, disclaimer, this is not mine. I wear tudung, so I don't show my skin. And also my body not this sexy also. Peristomal hernia. Okay, this is why I actually suffer from this. I think about 6 months or there. Actually, I realized that I actually got this hernia. Suddenly, I felt a bulge. So basically, it actually there's a intestine, and your intestine actually goes outward. Near your stoma, cause a bulge. So it's something like a heart. I don't know how to say this, like a bulge, and then under your skin you felt something hard. Hard. So what causes it? It's actually a pressure to the abdomen when it actually happens with severe or chronic coughing, severe sneezing, lifting of heavy objects also can weaken your muscle around your stoma. For my case, I think because after multiple surgery, my bladder is actually not that strong. So every time I need to empty my bladder, I actually have to cough. So to make sure that there's no residue of urine in my bladder. So that could be, and I think that's one of the reasons I actually got hernia right now lah. Okay, the hernia is actually, for the challenges itself, it actually grows gradually. It doesn't happen overnight. So slowly you can see the sudden bulge under your skin. So when you actually have noticed that there's a pain, discomfort around your stoma, then for severe cases that you're having trouble with your stoma appliances, usually at this point it's advisable to speak to your stoma nurse, or maybe reach out to your, what do I call it? Your stoma supplier, is it? You can look for iris also from Coloplast. Okay. Okay, how do you manage it and treat it? For hernias, it's actually quite common, and also you can just, how do you manage it? Just based on lifestyle changes, like losing weight, which I'm still struggling, but I'm trying. Lifestyle, like quit smoking, wearing a support belt. You can also use the Brava belt, help to ease the uncomfortable symptoms. Okay, how do you adapt to change? Okay, hernia is actually a common complication of the colostomies, ileostomies. In some cases, they are asymptomatic, and of course, a slight discomfort. For me, sometimes I feel like some kind of like a dragging pain, but it's still manageable. So you can, like mentioned before, make lifestyle changes. Then for severe cases, I mean, you also have to see your own doctor whether surgery is the way to go. But overall, what is important is you know your own body. You know whether is there something wrong. Don't try to dismiss your struggle or your pain. Look for someone for help. Don't suffer in silence. Okay, yeah, like I mentioned, have your own routine, be consistent what you do, and then for emotional support, do not keep it in because it will literally eat you up inside. It can fall under depression. So speak to someone, doesn't matter, to your friend, your colleagues, your neighbors. If you have a pet, talk to your pet also, because even though they can't say a word, they can still meow and bark at you. Okay, also, a bit of exercising, weight loss, maintenance, then also with the stronger heart, it will help to manage your stoma better as well. I think also, yeah, know your body. Like I mentioned before, you know yourself, whether is this good or is something bad that you actually encounter. You know yourself and look for the avenues for you to seek help. I think that's it. Thank you very much. Thank you for your time. I hope I don't bore you to death. Thank you.
Yeah. Thank you, Aziza, for an inspiring sharing. So as shared by Aziza, body shapes can also change during the day, movement, and with age. That is why it is important to do regular body checks. So another is, let's watch a video from another user's point of view on how Sensora Mio and BodyFit technology has helped him with these daily activities.
Adapting to life with a stoma takes time, and for many, the process is made more difficult because of leakage. We believe that the most effective way to reduce the burden of leakage is to improve the way ostomy appliances fit to the body. And the key to achieving this is to recognize that individual shapes vary greatly. A stoma can be on an outward bulge or hernia, level with the abdomen, or on an inward curve. The skin around the stoma may have dips, creases, or folds. Body shapes also change during the course of the day, during movement, and with age. That is why we developed an innovation platform that takes individual differences into account. It's called BodyFit technology, and it's unique to the Sensora Mio range of appliances. BodyFit technology helps to reduce leakage by ensuring the appliance stays securely in place. A prime example is this elastic adhesive used in every Sensora Mio. It's made from a special polymer blend that makes it twice as stretchable as a conventional appliance. So it fits snugly over the skin and bends and stretches the body. Another example is the integrated flex lines in the Sensora Mio convex shell. These provide flexibility without any compromise on stability, so people can bend in comfort and with confidence. Even the deep convex is twice as flexible as a traditional convex. BodyFit technology ensures people can get the appliance that fits to their individual body shape. It will continue to evolve and make an even better fit possible. Who knows what shape it will take next?
My name is Vincent Tam. I'm 52 and I'm using Sensora Mio contacts. I'm a very active person, especially I go to the gym a lot. And also doing a lot of DIY at home. Previously with the other product, when I wake up, I noticed that the plate detached from my body. With the Sensura Mio that I use, when I wake up, the adhesiveness and the plate is still attached nicely. So that built me more confident when I sleep. So now I even dare to sleep on the side. With this Sensura Mio, I can even wear those active outfit, going out to the gym. The color doesn't worry me at all, and it is like discreet, and I have no worries. Actually, I really don't have any worry about wearing this product. This Sensura Mio product I'm using now is the Sensura Mio Convex. So this allow the product to follow better contour to person body. So there are the flat type, there are mid-range, and this Convex actually is suitable for me because my stoma is a little bit inward. So with this product, I able to feel that it attached, the adhesiveness is there, and the flexibility is there and suitable with my profile. So perhaps that's the reason why it works wonders for me, and it was able to perform as what I expected, and the confidence keep on growing because it doesn't fail.
If you would like to learn more about Sensura Mio or even request for a sample, you can go to our website, visit.coloplast.sg/mio, or scan the QR code displayed on your screen. I repeat, it's visit.coloplast.sg/mio. Now, we would like to invite all of you, including those of you watching from home, to stand up. We'll be inviting Coach Fong for a light exercise workout. Coach Fong Lam is positive, engaging, and energetic. She loves to motivate and inspire people to better themselves in their fitness journey in their everyday lives. She is also certified in an exercise prescription for special populations, youth, elderly, and even pregnant patients, and have been working with seniors who are even at their age 60s to 90s. Please take out your Coloplast stretch band, and over to you, Coach Fong. There are Coloplast stretch band inside your bags. Yep. Take it over, Coach Fong.
Okay, my test. Testing 1, 2. Okay. All right. Yep. Okay. Good morning, everybody. You can hear me well? Yes, you're ready to move a little bit? Okay, so my name is Fong. Good to see everybody over here today. And I would like to invite our big brother in the area to have an exercise together. All right, so all of you have your band. Should we go on the stage so that the zoom angle will be better, or you prefer us on the floor? Can you still see us well from here? Not really. No, huh? We should go on the stage, right? Okay, so we just go up. All right, so I will give you some options over here. Okay, if need be, you can also be sitting down, yep. Good. You got your pen? Yes. Okay. So can I just put my... Okay, good. All right. So already, of course, if you need to sit down, you can sit down. If you like to stand up, you can stand up, right? Okay, so start off, we're going to have some warm-up. This warm-up, just be free and easy, be comfortable. You can be standing up or sitting down. Okay, your band can put it just at the side first. So big claps to our big brother Ilya for joining me on stage. Okay, and big claps for all of you for being here today. Okay, so we always emphasize that a lot of sharing today about still keeping active. We have very good examples from our sister here, Aziza. Thank you so much for sharing. Okay, all right, good to hear that. I believe that, yes, stay positive and keep yourself active. Not easy, the 2 kids. So, good example. And also our big brother here, you know, he's also very active. You will know about his story, amazing, amazing. He has crossed, yes, go to countries, take out challenges that not even normal people can do. So big clap. Okay, so now, yeah, getting our legs and feet and our hands moving a little bit. Are we ready to warm up? Okay, so now, over to our Mr. DJ. Okay. Okay, good. So now you just have your hands up at your own pace. We clap. Good. Then we clap. Yes. Down and up. All right, good. Okay. Yes. And then now you try this. Your hands go. 1, 2, clap. 1, 2, clap. Nice. And clap it there. Good. Now you clap to the front. Great. Okay, very good. And now, okay, give me your feet. Pump. Pump it. Good. Pump it. Yes. And then now a bit with your legs we go. Tap. Tap. Good. Rise up. And just a bit. Nice. Moving your legs a little. Great. Good. So far okay, So if you need to, you can sit down and do this also. Very nice. And now we swing the hands up. Good. And down. Okay? Swing up all the way. And down. Nice. Rise up. Good. And down. Very good. And then now, the hands swing to the side. Good. Swing to the side. Nice. And now, go. Good. Bit much. Slowly down your heart rate. Still comfortable, everybody? Yes, good job. Go. Much. Good. Swing the hands. Good. Much it. Clap, clap, clap. Good. Then go. Much. You can already. So much it. Good. Clap, clap, clap. Okay? Again, much it. Yes. Good. And then you go. Ready for the clap. Clap, clap, clap. Go. Good. Yes. Swing it. Next time you go hiking, can do this also, Good. Yes. Swing it. Nice. Woo! Good. And then we swing. Yes. And then you go. Clap, clap, clap. Good, good, good. There you go. Clap, clap, clap. Okay, now your feet and try. Clap a little bit more. Yes. Clap a little bit more. Great. Good. Sing it. Okay, march again. Nice. 1, 2, 3, 4, 5, 6, and clap. 1, 2, 3, 4, 5, 6, and clap. Yes. Good. And good job. All right, so far so good. Now you find your heart rate lift a little bit, So your body is ready for more. Okay? The music, I think a bit more. Okay, can you still get the beat, Okay. So now, okay, you need to sit down a little while, rest. Okay? Okay, I think you're all ready. Okay, so now, can pause the music for a little while first? Okay, let me show you what you're going to do next. All right, we're going to have 4 sets of exercise, 4 different exercises, each lasting 30 seconds, okay? So some of it, we're going to have your resistance band, your loop over here. So first exercise is very easy. Everybody can have your hands inside here. From the top, you pull it down. Okay, from the top, you pull it down. So, see from here, okay, Mr. Big Brother here, he's the front profile, show the side profile. Put it down and rise, good. From the top to the low, so you feel your shoulders working. Everybody can try this, okay? So we're going to do this for 30 seconds, okay? 30 seconds, we're going to have the music. 30 seconds of what, then we rest for a little while, then I'll show you what's the next exercise. Okay, good. Okay, now from the top you try. Put it down and rise. Good. You must have the tension here, put it down and rise. Okay, good. Nice. We should give you one. Let the MC try also. Good. Yes. This MC, we got extra band for you, Good. Yes. Good. There you go. All right, now is the real thing. There we go. You can try. Good. Go on. Yes, good. All right, there you go. Yes. Put it down, and down. Never mind, you have the tempo of your body already. And you go on. Great. Put it down. Very nice. Good. And there we go. Okay. Now I can think of a favorite song. Good. Okay, hold it there. You feel here? Big, show your arms at the side. Good. Okay, that's about 30 seconds. In 2, 1, and rest. Okay, good. Now you shake it out. So far, okay? Okay. Now, second exercise, you put your hands here. Very nice. Okay, so he showed the front, I show the side, 3, 2, 1. You try this. Now open up. Very nice. One hand in front, one hand to the side. Good. Yes. There you go. 1. Good. Okay, we have the rhythm in our body already, Very nice. Good. To the side. Very good. Side. And go. Yes. So one hand hold here, not moving. The other hand pull. Then come back and meet. And then go. Yes. Good, good, good. Everybody is doing very well. Nice. Good. Put it like that. See your hands already? Good. Nice. Yes. Now. Good. And now rest. You start to feel your hands? Okay, now give yourself the option. If you need to have your chair in front of you, you hold it here this way, you squat a little and you lift up. Okay? So you can see that you're going to have your hands holding here, squat a little and you lift up. Okay? Good. If not, you can also, all right, sitting okay, your hands over here, you squat a little bit, then you stand up. So in your squat, good way to build strength in your legs over here. See that your feet step wider. This will be able to balance. Squat low and rise. Yes, very good. Our brother is doing well. Okay, believe in yourself. We can do this. And we move. 3, 2, 1. There we go. A little squat. Very nice. And rise. Good. Doing well. Squat and rise. Go low. 3. Okay, you do about 10. Go 4. Good. Yes. So need to have a chest here. 5. Nice. There you go on. 6. Good. There you go. 7. Yes. So imagine a chair, the band to sit down. 8. Great. And go on. 9. Yes. And a 10. Well done. So far okay? Okay with this? Now you feel legs a little bit, Okay. Now we try. Like this is your, let's pull this apart, you just hold it this way. Very nice. You want to put it away, as you pull, you tap to the side. Tap to the side, okay? Ready, and we go. We're going to have 20 tap, We go 1, good. And 2, good, very nice. So think of your toes touching. Great. There's a 5. As you tap out, you pull apart. 7, very nice. 8, great. See the nice shoes down there tapping. 10. Okay, 10 more. Yes, good, go on. Tap it 1. If the music in your cha-cha-cha here. Okay, last 4. 3, good. Last 2, and the last 1. So far, okay? You feel your legs, you feel your upper body? Okay, that's 1 round. We want to make things happy, right? We say double happiness, make it happen again. Okay, we're going to do 1 more round. Okay, Chinese, we say, well, 好事成双, make it double. So, we go back to the first one. Remember what's the first one? Maybe remind me, just in case I forget, right? Yes, hands up in the air, then we put it down and rise. Okay, can we right now increase it? From 10, we're going to do more. Let's do 20, okay? 20, Big brother, okay, Good. Big brother is always okay. Ready, and we go. 1, good, nice. 2, very nice, okay. Put it here, 3, maintain, very good. 4, put it aside, good, yes. 5, so you think from narrow to wide. 6, good. Okay, we draw the mountain here. 7, yes. Go 8, good. Too strong. 9, okay. 10, building muscles, give us 10 more. Now we count down 10, 9, yes, 8. So this one you can always do it when you're sitting down watching TV, okay? All right, or standing up in the park, you can do this. Now count down, we have the last 3, count down with me, okay? Last 3, good, 2, and a 1. Well done, you're the number 1, okay? All right, next one, the hand side to side, okay? Then you build strong arms, all right? We ready? You know why I build strong arms? Are there shopping, the hands got strength to carry on shopping bag. And then tell your husband, happy wife, happy life. This one, the man saying one. Okay, already, but my husband say happy wife, he stay alive. Okay, are we ready? And we go, 1. Good, now with 20, 2. Yes, 3, 4, 5, very nice. 6, 7, great. 8, okay, we have it 9, and a 10. Now from 10, we count down to 1, 10, 9, good, 8, 7, then we have 6, just in case I forget my number, 5, forget my number, I start from 100, 4, last 3, 2, you got it, 1, and you say you are number 1. Okay, good job. All right, the next one I'm going to have the squat, filling the legs, Okay, so you see, upper body, you did the work. Now we go to the legs again. The squat. Now the same. 20 squat we can, right? Okay. So ready. Good. In 2, 1, and we go. You go down 1, then I rise. Good. 2, then rise. Okay, 3. Good. Then go. 4. Very nice. Not that you wear mask, I can see your smile, 5. 6. Very good. Oh, brother there. 7, okay? Build strong legs here. Your quads, 8. And your glutes, 9. And a 10. Now give us 10 more. 10. Good. 9. Yes. Okay, think of sitting back. 8. Great. How about 7? Great. You got it. 6. 100. 4. I don't even pass my maths. Last 3. Okay. 2, and you are number 1. Okay. All right. And now, pull apart. Okay. Then you want to eat something in front of you, your favorite stand to pull apart the package. All right. 20, tap. We can do this together. Okay. In 2, 1, let's go. Tap 1. Yes. 2. Yes. 3, 4. Great. 5, 6, 7, 8, good, 9, 10. Your favorite snack inside, I must have. 10, 9, 8, good, 7, pull apart, 6, 1,000 now. 4, must get ready, must count, 3, 2, and a 1, and number 1, you are the 1. Okay, well done, everybody. All right, I think you all know me as the coach who is leading exercise for today. Maybe I'd like to take this opportunity to do some sharing, how I get involved in this. My husband, okay? All right, he's also a user. He's also a survivor. We know Ilya for the longest time for being a big part in our support group. We have our sister there, Madalena, attending to him. Okay, guiding me how to use and change, all this equipment for him. So we are very thankful. And I would like to also share that I've seen my husband from being a very, very, very fit person. I think I'm quite fit, lah. He's the new version of me. Okay? He got diagnosed when he was very young, 39, only 39. All right, and we got 2 very young kids then. They're in primary school. So of course it's a, hey, you can sit down already. You can sit down already. Now relax already. Okay. Of course it's a big turning point for us, lah. But from someone who is very fit to someone who is losing the strength to even walk, it's really no joke. It's really no joke. He's a personal trainer. We are trainers ourselves. So I really see him from strong to really no strength to slowly building up. He lost all his muscle mass. So people see him before and after, and then after that, after again, it is really a long journey. But one thing I learned from him a lot is always what our sister there, Miss Aziza, saying, must you do something, cannot be depressing. It's true. He still make a point to wear his walking shoes and go for a walk. He still make a point to find things to do and make himself happy. So leading a happy lifestyle is very important, okay? And you have the good products over here to support through. he used the products every day. Every week I change for him. So believe in it. Caregivers are very important. I've been myself for all this while, okay, because he was wearing it for quite a while until he did a reversal. So he was wearing it even during his chemo. He has 6 cycles of chemo. Yeah, so everything is possible. With a strong support group, with your family members, your loved ones, you are still the number one. Thank you, everybody. Thank you. Okay, so in terms of exercise, any other things you'd like me to share? I can share whatever I know, yep. But I know one thing very, very sure. Start slow and steady. Start slow and steady, right? Because you still need very good core control. You still have to do something, you cannot don't do anything. But just be selective with what you do. Be selective. So even started off, if you start your exercise, it's okay. I think maybe you all have watched our video. There's actually videos on the website, on the Facebook. You can always be sitting down and doing exercise first, build the strength before you stand up and do. So there's really many, many things that you can do. So don't think of what you can't do, think of what you can do. From what you can do, improve. Then things that cannot do, one day, you can do it. Okay? All right. Thank you, everybody. Okay, so before you go on, now you just sit down, relax, and stretch it first. Huh? Okay, I think your arms are feeling a little bit of ache already. So hands in front of you and stretch it to the side. Okay, we have our sweet drinks here. Good. The big sister there, smiling off. Okay, very nice. And then the other side. Good. Okay, so see that your hands straighten, you hold it there. Very good. So hands straighten, you cross it over. Yes. Thank you for having me, and thank you for being on stage with me. Okay. And now roll it. And remember, big claps for yourself, and you are number one. Okay, thank you, everybody. Yes, I will remove the chair. You need the chair there? Oh, okay, I think you need the chair. Okay? I'll still be around. Anything you can ask me,
Thank you, Coach Feng. Yeah, after that energetic workout, I hope you felt great. If you want to follow more exercise from Coloplast, you can visit our YouTube channel at Coloplast Singapore. But of course, you have to check with your doctors or your ostomy nurses regarding what kind of exercise are you able to do. And like what Coach Feng said, start slow and start like from baby steps, and you progress slowly. Yeah. I'm sure many of you also have questions about, questions about how we can continue to have a healthy body and peristomal skin. So we are now going to a panel discussion where you can post your questions for our panelists. On our panel, we'll be having Miss Angela Liu, Mrs. Aziza, and Miss Iris Ong. So this panel is moderated by Mr. Elil, President of Ostomy Association of Singapore. And for our online audience, please feel free to post your questions into question and answer function. And we will try to answer as many questions as possible. So the panelists, the stage is yours.
Right, so thanks to all the panelists for coming on. Any of you who have any questions at all regarding anything, all right, about ostomies, what we have discussed today? Yes?
Hello, hello.
Yes, we can hear you.
Okay. Actually, I'm a caregiver for my mom who's 91 years old. she has 2 stoma bag in, one I think is a Euro bag. I think Iris know, she came to my house. One is a Euro bag something, and then one in the front is the stoma bag like that. Okay, I'm a caregiver, I got a lot of challenge. Sometimes in the night I wake up because there's a leak. No, because sometimes when you put a bag, there's smell. So when there's smell, I thought was leak. I got to wake my mother up, go to the toilet, and check the 2 bag surrounding to see where's the leak. But apparently, sometimes I find no leak, but there's smell. So I understand this stoma bag. I didn't use this. I used another one. That I think another one is the bigger filter. The filter sometimes, Iris told me, after sometimes become black in color. So how does the smell come out? And then sometimes the smell just give some type of alert, whether is it leaking or not. And every time I got to rush. And then the Euro bag that my mother has a tube that comes out from the inner part of the body out into the Euro bag. And that one can only be done by the nurse in the hospital. And I also scared that one also leak. If leak, I go rush her to hospital, that's it. But this bag, I can do it because Iris has taught me, so I can do it. But that one I can't because there's a tube that comes out. So that tube actually has been sewed into the bag to prevent the tube from moving. So if that bag comes out, that's it. I can't do anything. I got to rush to the hospital. So these are the things that as a caregiver, my mother got this 2 bag. Okay, my mother was a colon cancer. In 2015, she got an operation. She removed 30%. They stitched the colon. At that point of time, perfect. She recovered very fast. But because last year, she relapsed. She got another colon cancer came back. She cut another 30%. Because of COVID, hospital cannot visit. My mother got stroke because, at the age of 90, if you don't have next of kin next to her, she get worried why she's there, and then sometimes she want help. Help don't come so fast, because in 2015, my daughter sleep with her in the hospital all the time until she recovered. But this time cannot visit. So she got stroke, and then after stroke, she went back. After the surgery, 2 weeks later, we thought it was a hernia because there was a lump, and the lump was very pain. So we rushed her to hospital, thinking it was a hernia because I called the surgeon. There's a lump. He said maybe it's a hernia. But after they do an X-ray, they found that the colon did not heal. There's a hole on the stitches, and it leaks from there. All right. That's why the stoma bag came in already. So when the stoma bag came in November, it was working fine. Then after 2 weeks later, another part of the body, because the leak travels, they call it a track. So it traveled to another part of the body, and the lump came out again. So they got to poke a hole, and I got to put this bag in there. So there's one stoma bag, and the other was a Euro bag. So I got these 2 concerns that sometimes smell. So I was a bit worried. And the other one is the thing, because even the 2 days ago, the one with the two-piece Euro bag, somehow the plate sticks there, but the other part came out while she was sleeping, or she after wake up to go to the toilet, and normally I will just follow her behind, and I saw the bag dangling because the wire the tube was there holding the bag. So I wondered, I got this sometimes that it leaks and it can come out easily, and the smell.
Right. So from what I get, you have two parts to your question. I think this is a question that Iris would be best placed to answer.
I
Iris,
answer.
yes.
Okay, actually, in the case of Mr. Teng mother, it's not a stoma, it's a PEG drain tube. So because due to the complication of operation, she has this thing called fistula. So actually, it's not a stoma. This fistula is like a track. In Chinese, we call it 老鼠洞, like a track. No, so it's not healed. So liquid or sometimes like semi-stool liquid will come out. So in the case of Mr. Teng mom, in the center part, there's the fistula. So we do pouching. So what I do, the hospital, they give her the one-piece pouch with the filter. Okay, and then she has another bag. The hospital, they use for her the urine bag, like the 1758. The one is like draining liquid. So in like urostomy bag lah. So two-piece system with long wear and two-piece system. So when the two-piece system is like a drain, we call it a PEG. So it's like a tube inserted into the body. They do stitching. So liquid like bowel, usually bowel fluid, will flow out from there. Okay, why there is smell? Because due to bowel fluid. And then for the urine bag, right, there's no filter. In all the urine bag, there's no filter, so it cannot filter any smell. And then it leaks because it's a two-piece system. You must know how to detach, attach, and then you must lock. Sometimes due to maybe movement, never lock properly, the bag will dislodge out. Yeah. And then for the one-piece system, because also draining some feces and bowel product, when it's watery, right, the liquid will backflow to the filter. So when the filter turns black, it no longer functions already, which means your bag will balloon up or it cannot absorb smell anymore. Yeah, so perhaps maybe you can try our male one-piece system where the filter is all round, so it could help with the fistula. Yeah, so if let's say leak, right, I suggest maybe you go back to that's the one. You go back to Tan Tock Seng Hospital, ask the nurse to take a look, because I saw the picture, right, you show me quite raw at the skin. Maybe I have to do something about the drainage tube. Maybe I have to do some stitches to tighten it, or maybe change a new tube, or maybe, so in the meanwhile, you use the method that I've teach you, powder spray. For the broken skin. Yeah.
Right. Thanks, Iris. And I'm sure Mr. Teng can engage with Iris later on to examine. Yeah. Right. So thanks for the question, and thanks, Iris, for the explanation. I think the next question, maybe I direct it to Sister Angela. This is a question from Charlene. She says, how does one know if one has developed hernia for a patient with an ileal conduit?
Okay, so usually, like, I think what Aziza shared is that hernias, right, they are slow and they're gradual. So hernias, there are different degrees. Usually what a hernia is when your surgeons create your stoma for you, they do an incision on your abdomen and they pull out the intestines from there and then they sew it on the skin. Now, usually for people with good muscle tone, and all that, it should not be a problem for you. How do hernias occur? Firstly is you engage sometimes in abdominal exercises or unsuitable, or you carry heavy weights, you have chronic coughing, or perhaps you're a smoker and you have chronic coughing, your abdominal muscles are lax. That's when hernias can occur, right? So sometimes it comes out as a small pouch, outpouching on your abdomen. So if you see your abdomen, your contour should not change drastically after surgery, all right? But unless they do a reconstruction and they take off a portion of the muscle. But if you start to see that there is some outpouching and all that, and you find that, how come my ostomy appliance, when I pouch it on, it used to be able to last for a full week or full 4 days, and now it can't do that anymore. And you start seeing this bulge becoming more and more prominent, that's when you need to, number one, probably contact your stoma specialist. Number two, you may need to if it really bothers you, it's painful, you suddenly feel that there is less output coming out from your stoma, the thing we are worried about with a hernia is obstruction, then you need to go back and see your surgeon. Perhaps if it's so big and debilitating that it is causing you a lot of discomfort, then you may need to consider surgery to repair the hernia. But other than that, usually if the hernia doesn't really trouble you very much, we can use the accessories like stoma paste or strip paste and all that to alleviate the skin contour changes. Then we usually try not to go too aggressively and go into surgery. Yeah.
Thanks, Sister Angela, for that. The next question, maybe I want to bring in Coach Fong. This is also from Charlene, one of our online participants. She's asking, what are exercises for hernia prevention?
Sorry, what are the questions? Sorry, what are the questions?
Are there any exercises that you can do for prevention of hernia?
Strengthening of the core.
Okay, maybe you can...
strengthening of the core. Okay, so Depends on, various options. So what you can do is strengthening of the core. If lying down is not ideal, you can even think of lifting up sitting down on the chair, and you can see, and lift up your knees bit by bit, okay? And yep, then you go this way, okay, prevention. And also maybe sometimes you do some leg exercises like this, slow and control. So the gist of it is getting slow and control movement first. Nothing big and too big jerk here. Yes, okay, good. So other than that, strengthening. It's more like strengthening.
As you can see, Coach Fong doesn't tell you to lift any weights.
Yes, it's not about lifting heavy.
So you
yes.
should not be lifting anything, at least, especially in the first few weeks of your surgery, until everything has fully healed.
Yeah,
right?
in actual fact, you are right. The first few weeks is not advisable. So always wait for clearance, feel comfortable, then we start on something, what we mentioned, baby steps. Right.
Thanks a lot, Coach Fong. And I think there's a very timely reminder from Sister Angela as well that make sure you get clearance and check with your doctors first, right? When you can resume activity and at what intensity. All right. If you are in doubt, you can always reach out to us. We have resources at the OAS. We have access to Coach Fong. We are good friends, as well as both Coach Fong and her husband Sean have released a series of videos with the kind support of Coloplast. You can find these videos on the Coloplast YouTube channel, as well as the OAS website, right? So go there and you have access to all these videos, and they're absolutely free of charge. But the reminder again that you should check with your physician first when you can commence doing such exercises, right? Any more questions from the floor, please? Yes.
Hello. My name is Billy. Now, I noticed that the Sensura Mio, all right, the bag is actually quite small. So I wonder, is there any rationale why the bag was manufactured in such a manner? And I'm just proposing that maybe perhaps, the manufacturer can actually have two sizes, a slightly bigger one and a smaller one, because every time if you have a full meal, our feces will be more. Yeah, so, and sometimes, when we travel out or driving or that, it's very inconvenient for us to discharge, the feces. So I'm suggesting that perhaps two sizes will be quite useful. Yeah, thank you.
Thank you for your feedback. Yeah, when I do home visit, I also have patients telling me that the new meal bag is smaller. So I think when the D&D or R&D the department do, I think they take into consideration like I think some patients do feedback like bag is too long or too huge. So when they wear shirt, right, if let's say you never fold it in, right, you can see. So maybe they do it like in a way to make it shorter for more discreet purposes. But we will bring this feedback to our global side. Yeah, thank you. Yeah.
Can you hear me? Okay, yeah. I'll just feedback a little bit as well. So I'm Alex, the country manager for Coloplast. So, okay, oh yeah, for the people online. So it is a brand new product that we have brought in. So we have only brought in, we'll say, limited SKUs right now into Singapore for the main items that we're moving. So we will continue to, bring in other products and stuff. So in the line, there is something called more of like a high output bag, which will be a bigger bag, but it is not anything that we have brought in as of yet. So it's good to, have these type of situations where we can, meet and interact with the actual users of the products to see, what is the products that they need, so that we can go and look to bring those in as well. So thank you for the feedback, and we will see what we can do to try to bring in. But the product is quite new, so we only launched maybe a few months ago. So still trying to get an idea of, what is it that people really require and need here, as there are a number of items and stuff like that, and we cannot bring in everything, but we will take that in. So thank you.
Thanks, Alex. I have a question that I would direct to Sister, my dear friend Aziza. Yes. So I mean, from your sharing, I think you're very inspiring sharing earlier on having 2 children, a family, as well as being so active. And I like your bucket list. And doing the 21 kilometers with all the obstacles, I think was awesome, the Spartan race. So I just want to ask, when you, now that you say you have developed a slight hernia, do you continue to do these exercises at this intensity? Especially I saw you skipping as well. Yeah.
I have not done, because since post-COVID, since COVID, Spartan race has already been postponed or cancelled locally, overseas, but we still have the borders restriction. So I have not trained intensively for Spartan race, but I continue on trying to build my stamina, so I start skipping, but at the same time, it also helps to maintain or do a maintenance. But sometimes I always make a how do I say this? Before I start any kind of this, I will try to empty my bag first. Sometimes I do like push up, something that is actually I need to put to lay down. So make sure to have some kind of high-waisted pants or high-waisted leggings to help me to control my movement. Also helps to control my core. So but skipping is actually good. Doesn't matter whether you are actually overweight, thin or what, as long as you it's actually help with your core muscles also. Yeah.
Yep, thanks. Just wanted to say that there are a lot of ostomates who are actually very active before they had their stoma, and many of them actually has questions about getting back to sports and all that. So I think your experience is very useful. And if you have any friends who have been active and they want to get back into, doing the swimming and all that, we have many Ostomate ambassadors who are still very active. Please reach out to us. We can put you in touch with them to give you tips, right, and techniques and on how to remain active and continue to do the sports that you always were doing before your surgery, right? Yes.
Do you use a hernia support belt on top of high-waisted support pants, or do you use either one?
So it depends on the. Okay, so I still swim. So when I'm swimming, because I'm wearing my swimming trunks as well, so I just use a hernia support belt underneath my high-waisted swimming trunks. But if I'm doing weights, for example, or resistance bands exercise, which are a bit more strenuous, then so the support belt, the support garment that I use for my swimming it comes like a brief, right? So you just put it on and then you put the trunks over it. But when I do the more intense exercises out of the water, I have a separate support belt, which I wear over my shorts. All right, that provides firmer support.
Are there many companies having this hernia support belt, or only one?
Okay, so at the moment, there's one company that is providing the support belts. It's called Sozo, and it's at Novena Medical Center. They have nurses there who can guide you with the measurement and get the appropriate support for the support belts. So again, the resources for this are found on our website, www.oas.org.sg. And if you really need to know any of this information, you can always reach out to the good people from Coloplast as well. They are in touch with us, or any of your stoma nurses. All right, all of them have the information. We're all one big family here. So just reach out and ask anyone, right? We'll put you in touch with the right people. Right, in the interest of time, we have time for one more question. And we have an online, in fact, this is just a feedback. It says that and this is from an anonymous attendee online, just a feedback, the locking mechanism of Sensura Mio for 2-piece bag is also very small. So would someone like, Iris, would you like to address that?
Okay, they do it small, okay, of the Mio. If you can see the 2-piece is a blue color locking mechanism. If you realize the clip lock is faced inwards towards the patient, okay. So because we have feedback previously last time that when the old bag, the lock is outside, is rather big, right? So at the edge of your chair or corner of the door or sometimes the table, you accidentally knock it, the bag will open. and then it will cause leakage. So now they take into consideration, okay, they make it a little bit smaller, more discreet, and then facing the patient. So if you accidentally do any knocks or no bump, then the bag won't automatic, the lock won't automatic remove, and then the bag won't drop out. So this is the a little bit of different and improved version. But I do have patients, as some elderly patients, they say too small, cannot see. Then I say, never mind, you use your fingertip, you feel, and then you use two hands, you open it like that. Yeah.
Thanks, Iris, for the very useful tip. So we've come to the end of the panel discussion, and I want to thank all our distinguished panelists for providing the insights, and want to thank everyone here for being such an engaging live audience, and everyone back home who is watching this online. Thank you very much. Thank you.
All right. Thank you, panelists, for the insightful discussion. We would now like to close our live stream session. Thank you to all of you who have taken their time to dial in from home, and we hope you gain valuable knowledge through this event. Also, do help us to complete a short post-event survey by scanning the QR code on the screen, and also to keep in touch and always be updated on our future events and activities. Please follow Coloplast and OAS in our social media platforms displayed on your screen. Thank you for joining us, and have a great weekend. For those who are here, we'll be having a short...